Good evening, Canada. We are back with a brand new episode of our title show, Voice of Canada. Your host, Asphandiar Wadiwalla. My charming co host is Liliane Bahloul.
Thank you.
And we have a very dynamic guest today from UHN, Toronto. I would call her a wizard because I've undergone and I've been associated with her for over 6 to 7 months in her treatment. And I know this woman has really, and today I'm alive is due to her.
Oh.
Believe me. So Dr. Andrea Furlan, who is a specialist at the Rehabilitation Hospital, UHN. Welcome to our show, Voice of
Doctors or other doctors or nurse practitioners. So once they are referred to me, they come to our pain clinic and they are assessed by our team. We have a multi-professional team that assess and measure a lot of things. The patients complete a lot of questionnaires. And then they come to see me as a doctor. And usually what I do is I get all of the reports that other people that saw them, and we examine the patient, we talk to the patient, and then we give a diagnosis. What is this? I'm in physiatry, which is a specialty that I am, rehabilitation medicine. I specialize in rehabilitation of people with chronic pain. So then we tell them, the diagnosis, what is the diagnosis that they have, what is the cause of this pain, and then come up with a plan, how we think that they can overcome that problem. So that's the rehabilitation approach for anything. Rehabilitation, we do rehabilitation of people who have a lot of disabilities, could be spinal cord injury, brain injury, but I focus on rehabilitation of people who have chronic pain because it is a kind of disability.
Yes.
Chronic pain, it's what I call an invisible disability because the person cannot do things, but nobody sees. And some people are called like lazy because the family, the co-workers, they say, but you look so normal, you look good.
Right.
Why you can't do things? So it is a type of disability.
It's a person who suffers only knows the pain.
Yeah.
It can also go unnoticed over a period of time because the person gets used to having the pain until they experience not having the pain. Then they see, oh, I can do that.
Yeah. Although it's hard not to notice the pain.
Right.
I would say everybody who has chronic pain is defined as pain persisting every day, ongoing for at least 3 months. So if a person has 3 months of daily pain, they are classified as chronic pain, and it affects 1 in 5 adults. It's a lot of people. It's 20% of the population.
Oh, wow.
Dr. Furlan, from your bio, I read that you are a scientist at KITE. What does it mean by KITE? K-I-T-E?
Yeah, KITE is the research part of the hospital. It stands for Knowledge, Innovations, Talent Everywhere. So the name is just saying, there's talent and innovations and research. Yeah, that's KITE. So it's the research portion of the hospital, the Toronto Rehab.
Means you keep on doing the researching.
Yeah, when you see that building, so there is a part that treats patients and there is a part that is the scientists. And I work on both. I work at the hospital and I work as a scientist at KITE.
Lovely. Go ahead.
Okay, so my next question is related to your book, The 8 Steps to Conquer Chronic Pain. It takes discipline actually to follow the 8 steps. I was going through the book, and it's if we can follow the 8 steps, even in like a normally healthy person, I think there's a way to prevent.
That's right.
That. Can you tell us more about your book?
Yeah. So I wrote the book it was my dream. I had a lot of knowledge in this head, and when I turned 50, you can imagine how old I am. In 2019, I turned 50 years old, and I said, I'd like to leave a gift to my patients, to the people suffering from chronic pain. And I thought about writing a book, but it's so much work. And I spoke to my son, and my son at that time, he was, I think, 18. And he said, Mom, don't write a book. Open a YouTube channel. So in 2019, I opened the YouTube channel because I wanted to share the knowledge that I have. But then in 2021, when I had passed more than 100,000 subscribers, now I have almost 600,000 subscribers.
Wow.
But in 2021, I said, wow, now I wrote so many scripts for my videos because I write the script for each video. I said, I have material for a book, and I approached a publisher. So the book is kind of a compilation of all the messages that I have in my channel and that I learned over this last 30 years. I graduated medical school 30 years ago, and I think I learned a lot, and I wanted to put all of this into one place. And then my editor helped me to say, okay, you need to organize your thoughts. Is there a stepwise approach? So then that's how I came with the idea of the mountain, climbing the mountain. And so to get to the top of the mountain, there are 8 steps.
So, Doctor, the question which I was about to ask you about the YouTube, you have practically answered half of it. So, but and we are very, very happy that you have produced over 150 videos, and they are really, really useful. Because I did use your 3 videos, followed it strictly, and it has got some substance in it. It started working. You know, the day I used to exercise, my pain used to take a duration was longer to come again. And all that stuff happened. And finally, I'm still doing some exercises, as you told me to continue. So as and when I get time, I do that stretching exercises of my back muscle. So it may not affect me.
And I learned those exercises with my mentor in Brazil. She's Japanese, Dr. Satiko. And she taught me, you know, when a person has musculoskeletal pain in the muscles, the best treatment is exercise, but there is a specific type of exercise. So she taught me, and that's what I practice and I teach my patients.
Dr. Furlan, tell our viewers of Voice of Canada that what do you think that the pain comes into the human body? What are the causes? It's the stress, or it's some, I think, injury, fall, accidents, the causes?
All of the above. So it
all
could
of
be,
the above.
So there are different types of pains. Not all pains are the same, and chronic pain can be caused by different conditions. So let me explain to you. There are mainly 3 that we divide into 3 mechanisms of pain. And the way I explain this to the lay public is using the analogy of an alarm system of a house. And I explain this in the book. So let me explain. So you install an alarm system of your house, if you have one, Lily.
We have.
So you install those sensors, right, for a smoke detector, carbon monoxide detector, a burglar, like a break-in your window.
A visibility detector and everything.
So then we have those sensors in our body to detect danger. So that's the pain system. We have this alarm system of our body designed to detect something is wrong, injury, damage, disease. That's why we have pain. So the alarm of a house is there to detect any danger to the house. And it has to be loud and unpleasant. So when it makes that noise, it has to wake you up in the middle of the night, because it has to alert you.
Alert you,
Otherwise, you would just continue sleeping and not wake up and see what is wrong. So pain also has to be unpleasant. It's the only sensation in our body that has to be unpleasant. So it's connected to the
brain.
In the brain, it's connected to the emotions and activate the unpleasant, because it has to wake you up and for you to go to the doctor and take care. So when there is so that's the first type of pain, is when there is, if there is a fracture, bone, a toothache, an appendicitis, an inflammation in a joint, something is wrong there, and you need to go and take an anti-inflammatory, or if there is a burn, you need to stop putting your foot on the fire. So that's the first type of pain, which is called nociceptive. I'm sorry for the names, but I don't have better names. It's called nociceptive.
All interested people will Google or whatever they want to find out.
So that's the pain that we all feel when something is injured, damage, disease, an inflammation, a cut or something, surgery. Now, the second type of pain is called neuropathic. And that is when those wires that connect, like let's say that there is a cut here, the surgeon do a cut here. So that's nociceptive because there is something here. But let's say that the wires that carry the information to the spinal cord and then the spinal cord to the brain, let's say that they are compressed or injured. So then they may also send messages to the brain that something is wrong. And the person will say, this is pain. But it's not actually, they feel pain here, but actually it's maybe a compression here. So an example of neuropathic pain is trigeminal neuralgia, that the nerve is compressed here in the face. Herpes zoster, that they have zoster from the chickenpox virus, or carpal tunnel syndrome, that the nerve is compressed here, or diabetes that affects the nerves of the legs and the hands, and then the person starts having pain. So that's because the nerves are damaged. So the second one is neuropathic. Those two you can know where is the cause, and you go there and you can fix there. Like if there is a nerve injury here, the surgeon can decompress the nerve. Now, and this would be equivalent in a house. For example, if your alarm system of your house, let's say there is a short circuit somewhere, and you open the cupboard of your kitchen, the alarm goes off. So you need to go and fix the wires.
And find out where the exact location
maybe have a short circuit, and then you fix it. Now, the third type of pain, which is very common for chronic pain, is when the alarm system of the house is deregulated. So you don't call the fire truck, the police, or the ambulance to fix the fire alarm. So the fire alarm is going off all the time, making noise all the time. There's a defect
in it.
Because it's defect. There's a defect in it. It's malfunctioning. So nociplastic pain is the third type of pain. And that is when our pain system now is deregulated. So even though the person may feel pain in the knees and hips and everywhere, the problem now, it's not in the knee anymore. So you don't focus on fixing the knee anymore. You have to increase the threshold of pain because the threshold is low. So you fix the pain system. You fix the alarm of the house. And that's hard for people to understand because when they come to me, they say, well, but I want another MRI of my spine because I have pain all over my spine. I said, that's not going to work because your pain is not in your spine. It's in the pain system. We need to fix the alarm of your house. And again, usually it's because the threshold of this alarm is so low. So any kind of thing that normally would not cause pain, now it's registered as pain. So imagine in a house, you want the alarm to go off if there's a fire in your kitchen. But if you light a candle, makes some smoke, you don't want that smoke to trigger the alarm and call the fire truck. So what do? You regulate the sensors, saying, okay, it's just a tiny smoke, it's not a danger. But there is a smoke.
At times while cooking also with the smoke, the alarms go.
Yes, so then you have to regulate the alarm. So that's what we do. We help people to regulate their alarm so then not a little bit of smoke will trigger the alarm and they feel pain all the time.
But your assessment department is thorough. Let me tell you.
Yeah, because we measure everything and lots of questionnaires.
It took me 2 hours when I came for the first time. Nobody did assessment in 14 months the way they did. Yeah. And I was amazed. Yeah. With instruments, with 2 people asking questions, measuring sites, spots, everything.
Yeah, because basically all of those 2 hours is to guide us. Is it a nociceptive, neuropathic, nociplastic, or a mix? Sometimes there's a mix of 2 or 3, because the treatments are different.
And when I saw you for the first time after that, you had the diagnosis to put in forward of me.
Wow.
These are the pain and these are the areas we have to deal with. Yeah. Her assistant was there first. He took a detailed review.
We are one of the few centers in the world
and
that
then
do this.
When she came and she said, no, we can treat you.
So if people would like to contact you, they have to go to you through their family doctor.
So the family doctor, I work, the central referral place is called TAPMI. TAPMI. So Toronto Academic Pain Medicine Institute. Okay. The website is tapmipain.ca.
Okay.
So all the doctors refer to TAP because TAPMI, we are all the pain doctors in downtown Toronto affiliated with the University of Toronto.
It's like a hub.
It's like a hub.
Okay.
Yeah. And they will screen. They will say, okay, this patient goes to Dr. Furlan, this patient goes to the other hospitals, like Women's College.
5 hospitals are there under the network.
We have many hospitals affiliated with TAPMI, and we are all professors of the University of Toronto.
I recall my daughter doing the TAPMI form.
The TAPMI form, yeah.
She did urgently. You can go and ask for the question.
So the triage is based on what? Like the patient can ask for you specifically?
They can. Yeah, they can.
They can ask for you.
They can. I tell them, if you want to be seen by me, the doctor has to write my
Dr.
name
Furlan,
on the front page. But TAPMI knows what kind of patients I see. And if it's more, for example, a problem of, let's say, headaches and migraines, then maybe it's better to see another doctor. Right. Some people have more abdominal pain, pelvic pain, gynecological pain. So then there's another doctor that is specialist in that. So then the person would not waste their time coming to see me, and then I have to refer to the other.
To that doctor.
Yeah, so they go to the right doctor right away.
Go ahead.
So Dr. Furlan, you got us intrigued by your topic. So did get you to choose this
Yeah.
topic or to specialize in pain? What did you have to do? You finished in Brazil?
Yeah, I finished my medical school in Brazil.
Yeah.
And then my residency I did in physical medicine rehabilitation in Brazil. But I knew I wanted to treat people with chronic pain. First of all, when I was a teenager, I suffered from debilitating menstrual cramps a lot. Every month, I missed, 2 or 3 days of
It's a common problem now.
It's a common problem.
Yeah.
So that intrigued me. I said, pain. Why can't we have a treatment for pain? So I always kept that in mind. But what really opened my eyes to pain, and even to say there's a pain specialist, I can become a pain specialist, was when I was in medical school. And I remember very well, I was in the last year of medical school and about to choose what specialty to go. And I was in the general internal medicine rotation. And we had just admitted a woman. She was, I can't remember, 40, 50 years of age. And we admitted her because she had pain all over her body for many months. And nobody knew what she had. And so we admitted her in the hospital to investigate. Yeah. And so we ordered all tests and everything. Everything came back normal. So then someone had an idea, let's call a physiatrist to come and do a consult. So here comes this doctor physiatrist, which is now my specialty. So he comes, he put needles on her, acupuncture needles, and she was lying down in bed, and he was talking to me about what is physiatry. When he removed the needles 30 minutes after, she was pain-free. Wow. She got up, she was walking, and we discharged her the next day.
Wow. It's a miracle.
I said the same thing. I said, what did you do? What is that? So he said, you never heard about fibromyalgia? So she has fibromyalgia. Fibromyalgia is an osteoplastic pain. It's this dysfunction of the alarm system. So he explained that to me 30 years ago. And then he said to me, what I did with the needles was I stimulated her brain to release her own medication.
Wow.
Because that's what the needles do. They will stimulate the pain system. And so she opened the pharmacy that she has in the brain. Wow. And now she released those medications, powerful opioids, because endorphins, you probably heard about endorphins.
Yes.
Endorphin is an opioid, much more potent than morphine. So she released the opioids, cannabinoids, we produce cannabinoids. She released serotonin, which is the feel-good hormone, and dopamine. And then he said to me, but those medications released by the acupuncture, they will last maybe 1 week and she will go back to what she was before.
Wow.
So that opened my mind to say, I need to study this pain thing.
Right.
Pain thing.
That's how I decided.
That triggered your interest.
That's how I got,
Triggered. We'll be taking a short break and we'll be back with you. Canada, your host Asphandiar Wadiwalla, and our charming co-host Liliane Bahloul.
Thank you.
And our dynamic Dr. Andrea Furlan is with us. We are very, very happy. Even our viewers will have lots and tons of information about the pain. And it took us over 2 months to get Dr. Furlan today for our interview. So thank you, Doctor. Once again, you came to our show.
Thank you for inviting me.
Doctor, tell us what is the difference, if we would make a difference between acute and chronic pain.
Yeah, acute pain can be either nociceptive, the one that starts with an injury, a disease, and inflammation, or neuropathic pain if there's an acute nerve injury, a compression to a nerve, epizoster. So acute is defined by time. So it lasts less than 3 months. So by 3 months, the acute pain should be healed because our body heals. The wonderful thing is our body heals. A lot of people don't believe this, but they do. Even a disc herniation, even a serious disease, the body goes there. We have cells that go the immune system and they heal. And so by 3 months, that acute pain should be gone. Your brain doesn't need to feel. If you continue feeling pain,
then it's a chronic pain.
It's a chronic pain. Yeah. So it's defined by time, and the time is 3 months.
We even have neuropath doctors. So what is the difference between a pain doctor and a neuropath?
I think you're talking about naturopath.
Naturopath, yeah.
Naturopath doctors, they are not medical doctors because they did not go to medical school. Chiropractors also are not medical doctors because they don't go to medical school.
Yeah.
So naturopath, chiropractors, they go to college after high school. It's a lot of studying. The naturopath doctors, they study natural medicine. So they study herbs and natural things like they study a lot about vitamins, supplements, and food and diet. And the chiropractors study a lot about exercises and posture and how you strengthen your body and align your body. But they don't go to medical school.
And the same goes to homeopaths also.
Yeah.
Same thing.
Homeopaths, some are medical doctors. Some medical doctors decide to
homeopathy,
do some course. But it's a course that they do. Sometimes a 1-year course, and then they become
But even in homeopathy, the medicines are different. They prescribe you some sweet tablets.
Yeah, and I don't know if they really work.
And usually Germany is very well known for.
There's not a lot of science to back up homeopathy. It's because it's also very hard to do clinical studies on
very
homeopathy.
Informative. Go ahead.
Okay, so your videos are really, really intriguing. So you have one of the videos, theme and body parts. And you also teach online. You have online courses.
Yeah.
I think everyone should have access to that. Can you tell us more about that?
Yeah, so the videos, I post them on YouTube. And it's just my name, Dr. Andrea Furlan. And as you said, the videos are divided by body parts and many things. So I have a website that I try to organize the videos because people have difficulty find the website is also my name, is Dr. Andrea Furlan, doctor with spelled out.
But you have the serial numbers. You gave me the serial numbers.
Yes, DOCTOR, AndreaFurlan.com. And then I organize all the videos, and I also have a lot of handouts. Sometimes I create a video, and then there's a 1 page or pages summarizing the exercises or something that I want them to print and look. So on my website, it's free. People can download them and all the handouts. Not all videos have handouts, but the ones that have, they are the video here and the handout here for you to download.
But they are also very useful for practitioners, not only the audience, not only the public.
That's true. You know what? I made the videos for the public, for the person with chronic pain. So the language that I use is a very lay terms and a very simple language.
Simple language, a person can understand.
Because I didn't do that as a lecture for doctors or nurses or professionals. But I get a lot of messages and comments and people who comment and contact me. And they are healthcare professionals.
Because it's the techniques.
They say, Dr. Furlan, I'm learning so much about chronic pain watching your videos. And then I told them, well, but this is not for, because I don't explain a lot the scientific side of things. And I use the language that is very simple. So because of this, now I am putting on my website some courses that I teach professionals.
Yeah.
The idea would be to teach professionals because I get contacted by people in Africa.
Oh, wow.
India, there are a lot of them. There is an excellent physiotherapist in India. There are Vietnam, Philippines, even in Ukraine, in Russia.
Ukraine
I had
too,
people who,
nowadays.
They learn from chronic pain watching my videos. A lot of people in the Spanish-speaking countries.
You speak Spanish?
I speak Portuguese.
Portuguese,
yeah,
wow,
I'm from Brazil and speak Portuguese.
So you're a multilingual.
Yes, and I put closed captions. My videos also to increase accessibility.
Yes.
Even because my own patients, sometimes they're not fluent in English. And they ask me, they say, I would love to watch your video, Dr. Furlan, but I can't understand what you say. So I put closed captions in 56 languages.
Wow. Wow. You're
Every
doing
video
a
has
remarkable
closed
work you've
captions.
done.
They can choose which language they pick.
Yeah.
And then they see the language written on the screen.
Dr. Furlan, in one of your videos, you explain in detail about the elbow and knee pain.
Yeah.
So talk to us about that and about tell our viewers what you mean by elbow and knee, because that is generally suffered by lots of people.
Yeah.
It's a very common
hip,
pain.
Yeah, hip
knee
and and elbow. I have videos for, like you said, for body parts.
Yeah.
I have I think one of my most popular videos is the shoulder with more than 8 million views. The hip and knee osteoarthritis. So what it means is a lot of people have osteoarthritis, and osteoarthritis is a disease, is an inflammatory disease that affects the joints, and slowly it's a very low grade inflammation that over the years kind of it starts destroying the cartilage. So we have the bones, and the cartilage that cover the bones is starting to deteriorate. And so the bones start rubbing against each other, and that may cause pain. Not everybody who has osteoarthritis has pain, but some people have. And so it's very common to have both the hip and the knee.
And the knee
they
too.
come together. Yeah, a lot of people have hip and knee osteoarthritis. So that's why I created a video that, because they also the exercises, when you're doing exercise for the knee, you're also doing for the hip. And when you do for the hip, you're also, because you're moving
Right.
both joints. So that's why I combine the hip and knee exercises. And I do exercises. I demonstrate in that video exercise that a person can do at home. Basically, all of those videos that I developed were during the COVID-19 pandemic, and people could not access a gym, physiotherapy gym.
Definitely.
So I had to think about, what can they do at home that doesn't require them any, equipment or expensive things. So I consulted my mother a lot. My mother has osteoporosis and she has some pains here and there. And I said, Mom, what exercise? Because she had to do exercise at home. I said, what do you do for your osteoporosis?
Beautiful.
She said she was grabbing a bottle of water and doing exercises up and down. So I use a bottle of water in my video. So that's what my mom told me. Yeah,
beautiful.
tell them
Simple
to use
and easy to understand.
Simple things like she was also grabbing like a bag of beans. She said, grab a bean bag and just, that would be your weights.
Right.
So that's what I tell in my videos, things that you have around your house that you can use to do exercise. Because I don't want them to spend a lot of money buying equipment that they may not need after.
Dr. Furlan, as you are aware that we have got severe winters in Canada with snow and even the temperatures going up to minus 35 and touching 40s. So how to protect for those patients who has osteoporosis?
Yeah, because...
What are the precautions of do's and don'ts during that severe cold winter?
Yes.
Will you give us some guidelines?
Not only that, but for anyone who has osteoporosis, falls is a big risk.
Big risk.
Yes, because their osteoporosis means their bones
are
have
getting
less
weaker.
Calcium. Yeah, they have less calcium than normal, so they're more prone to, if they have a fracture, if they fall, to break that bone. And actually, I don't know if you know this, but some people, they are walking and then they break the bone and then they fall because the bone is so weak that just walking, they break the hip and then they fall. They broke before they fell. So the major areas of breaking bones for osteoporosis is the wrist,
hip,
the hip, and the low back spine, the lumbar spine. So it's really important that, first of all, the winter, if there's icy patch, or even a lot of people fall and they break a bone of osteoporosis inside their house. It's not even outside of the house. So carpets. So remove all rugs that you have. If you have osteoporosis, remove the rugs because you can trip. Make sure that your floor is clean from clutter. Also, if the person has balance problems, check the eyes, the vision, check the hearing, because hearing and vision helps you to localize where you are.
They protect yourself.
They protect us from falling. They also, if they are really losing their balance, maybe install some grab bars in their house, like the washroom, especially. A lot of people fall in their washroom, bathtubs. And if they go outside, especially the winter, the snow, make sure that their shoes,
snowshoes,
that they are adhering to the ground. They're not slippery. Check. They're a little bit more expensive, the ones that adhere better to ice.
The grip ones.
So much, the ones that grip better.
Just like the snow tires we use in the cars.
Exactly. And then I know some people don't like to show that they are disabled. They don't like to walk with a cane or walker. But I tell them, if you need to go to the grocery shop, and it's good for you to go. You need to get out of your house. If you need to go with a walker.
Walk and
go.
Take some walk, take some fresh air.
Get some fresh air. They say, I don't want to use a walker. I'm not an old lady.
It's about safety.
But it's about safety.
मशरकी तहजीब की खूबसूरत दास्तान, बरसों से चली आ रही रिवायतों का पासबान, खुशबू और जायके का वही कदरदान, करते हैं हर खाने में अपने लज्जत का एहतमाम। हर पकवान है बेमिसाल, हर खुशबू है लाजवाब। कढ़ाई पॉइंट, जायका ऐसा कि दिल जीत ले। आज ही हमारे कढ़ाई पॉइंट तशरीफ लाएं और अपनी खुशियों को हमारे संग मनाएं। कढ़ाई पॉइंट, मेड विद क्वालिटी and flavored with passion.
Popeyes has opened a brand new location in downtown Vancouver. Satisfy your craving for Cajun at this new location off West Georgia and Hamilton Street, where you'll find all your favorite Louisiana-inspired menu items. We sampled the unrivaled trio of sandwiches, the classic, the deluxe, and the blackened deluxe chicken sandwich, and all were delicious. All of the signature fried chicken is marinated for 12 hours, then hand-battered and breaded, served with Cajun fries and mac and cheese on the side. Plus, for a limited time, you can try Popeye's Crispy Chicken Wrap, available now until September 3rd. Check out the new Popeye's location at 700 Hamilton Street today. Who are you bringing with you? Tag them in the comments.
This is the latest opening in BC for Popeyes, with more openings coming soon in both Alberta and BC by PLK Group.
Love that chicken from Popeyes.
HK Movers. Home, offices, apartments and delivery. Big or small, we move it all.
HK Movers.
Local and long distance. We also ship cars, Kalar transport and moving services.
For service with a smile, give us a call.
Call Mr. Harminder 416-524-6704.
416-524-6704 पे.
Visit 140 Advanced Boulevard, Unit number 10, Brampton.
Long distance moving specialist.
HK Movers. HK Movers.
डिक्सी इलेक्ट्रॉनिक्स और अप्लायंसेस पिछले 16 सालों से खरीदारों की खिदमत कर रहे हैं। हम लगातार 4 सालों से खरीदारों की पहली पसंद बने रहने का अवार्ड हासिल कर चुके हैं। हम किचनर्स, बॉश, वर्लपूल, एलजी, सैमसंग और जनरल इलेक्ट्रिक के ऑथराइज्ड डीलर हैं। 5 स्टार खिदमत का लुत्फ लें। हम आप सभी को टीवी सबसे ज्यादा रियायती दामों पर देने की गारंटी देते हैं। www.dixieelectronics.ca हमारी वेबसाइट पर जाएं या अभी कॉल करें 905-625-5900। सभी बहुत ही मुनासिब कीमत पर दस्तयाब हैं, जो आप बाआसानी से ले सकते हैं। At Dixie, we sell quality and deliver confidence.
Zoc. Now it's fully renovated. Live catering, barbecue, tandoor, जलेबियाँ और fresh naan. तकरीब आपके घर में हो या घर से बाहर, Zoc is providing full service now, and Zoc has opened a new banquet hall, garden event center. आपका Zoc देखकर लोग कहेंगे, क्या Zoc है आपका? Call right now 905-625-7786. Zoc वालों के लिए.
All the osteoporosis patients, they get an injection 6 monthly or 1 yearly. So that really helps.
It helps,
It helps it.
Or even the tablets. Not everyone can take the injections because they are very expensive.
Very expensive, yeah.
Very expensive.
6 months is about $500 per injection.
Wow.
Not a lot of people can have the privilege
afford
that. Mm-hmm. But there are tablets that the person can take once a week, and then they do the same effect of the one injection every 6 months. But they do the same thing. So what they do is they help to keep the calcium in the bone.
And it doesn't deteriorate further.
It doesn't deteriorate further, and also helps them to maintain what they had. But again, they do need the tablet or the injection does not replace exercise and does not replace a good diet that is rich in calcium, vitamin D, and magnesium.
Vitamin D3, you mean?
D3.
D3, yeah.
D2 is also good, but you need a higher dose of D2. D3, you need a lower dose because it's better absorbed. But the best thing for osteoporosis is actually using the bones and carrying weight on the bones, doing exercises. Because if the person stops moving and they are just taking that medication or the injection, it's not going to work.
Go ahead.
So I have a question about headaches. So everyone is different. What triggers headaches for everyone? So, and you were talking about 3 types of pain. So which one would headache fall into?
Yeah, good question. Because we have so many types of headaches. Okay. When we say headache, it just means pain in the head.
Yep.
So migraine is one type of a headache, which is a type of nociplastic pain. So migraine would be the third type. It's when the pain system is deregulated. How do we know this? Is because there's no point that you can, there's nothing wrong with your head is normal, but the pain system is sensitized, and the person has, days of the month that they have this migraine, and so debilitating.
Yep.
So for some people, migraine is precipitated by food, or sometimes it's precipitated by stress or by lack of sleep, or dehydration. But stress, physical stress and emotional stress is one of the biggest triggers of migraine.
Yeah.
Then the other types of headache. For example, we know that there are some nerve compressions like trigeminal neuralgia, cluster headaches. They are kind of a more nerve compressions. Trigeminal neuralgia is a very debilitating headache that affects the face here, and it's by the trigeminal nerve that is irritated here.
On both sides?
It could be one side or both.
Okay.
Yeah, sometimes most common is one side. There's another nerve here that's called occipital nerve that can also become irritated and inflamed here and causes a pain here in the head. So we have to treat the occipital nerve here. So that would be a neuropathic pain because it's a nerve injury. And then there is the nociceptive pain, would be pain that is caused by some injury to the head or by the muscles in the neck that have trigger points from muscle myofascial pain, and they are radiating up. So what you need to do is you need to treat the muscles of the neck, because then it's stretching these muscles, massaging these muscles, exercising these muscles, so they don't start shooting pain from up. So each one is different. That's why it's so important to have a proper diagnosis, because the treatments are.
And migraine pain is curable?
Migraine, yes. Yeah, migraine, it depends on how we call migraine. If the person has more than 15 days of migraine days per month, we call that chronic migraine.
Chronic migraine.
Chronic migraines. So for chronic migraines, there are some specific treatments which include botulinum toxin injections. There are also some other subcutaneous injections, some specific treatments for that. If the person has less than 15 days a month, which is not chronic migraine, then we don't use those treatments, but then we use more like lifestyle modification, which means modification in diet, exercising more, not on the days that you have a migraine. The days that you have a migraine, don't exercise. But the days that you're not having migraine, we know if the person starts exercising, then they prevent.
But there are videos on migraines also?
I have 4 or 5 videos on headaches. One of them is migraine. Another one is cervicogenic headache, trigeminal neuralgia. I have one video for each one of those types
so
of
after
headaches.
diagnosis only you can say which one.
So I recommend the person not to try to diagnose yourself.
Yeah.
Go to a doctor, a neurologist, or a pain doctor, or your family doctor, get the diagnosis, and then ask your doctor if those videos are proper for you or not. Because the videos are more to educate the person, but they do need to see a professional to get a proper diagnosis.
Right. Dr. Furlan, while reading your bio, you have formed 10 strategies for controlling pains.
Yes.
So would you tell us what are those strategies?
Yeah, so I like to simplify things for my patients, and I tell them, you need to have many strategies in your toolbox, like having many tools in your toolbox. Don't use always the same tool. So I recommend them to remember, I talk about the 5 M's that they can, think about. Because usually when a person has pain, usually the first thing they think is the pain pills. Where is my painkillers?
Right.
And they go to the pills.
True.
Right?
Yes.
That's the last M, medications. I like them to think about all the
medicines are the last.
Yeah, because I think if they try the other M's, the 4 M's before, they may not need medications. I'm not against medications. I love them. I think they're so useful and so helpful. But if you can get your pain relieved with the other M's, why would you put some drugs in your body that have side effects?
True. That
can affect your liver, your kidneys, right? Your stomach. So what are the 4 other M's that you should try before you go to medications? Awesome. They all start with the letter M, so to simplify. So movement, again, it's for exercise. Moving. And movement means aerobic or cardio exercises, or strengthening exercise, resistance, or stretching exercise, or relaxation exercise. You see, or balance exercise. We have so many types of exercise. You need to find the one that you enjoy, and do it. Movement. The other one is mind-body interventions.
Right.
Wow.
People don't think that, they are
That's
so
concentration.
Yeah, so for example, I told you before about the inner pharmacy that we have in our brain that my colleague, released with acupuncture. So we can open that pharmacy with meditation, with mindfulness, with some hypnosis. I had a patient many years ago, he stopped taking painkillers. He was on a lot of painkillers because he downloaded an app to his cell phone that did self-hypnosis. And he told me, doctor, every time that I had an urge to take a pill, I did 5 minutes of self-hypnosis and it passed.
Yeah.
Wow.
So movement, mind. The other one would be modalities. So acupuncture is more or less like that. But modalities like heat and cold and things that you apply. TENS machine, like you can put electrical pads, TENS machine. So modalities. Think about modalities because they're wonderful.
Yeah.
The other one is manual therapies, massage, manipulation, and you can do self-massage. Like today I was teaching one of my patients, he had some neck pain. You can self-massage your neck, the muscles of your neck. So manual therapies. And then the last one would be the medication.
Medication. Go ahead.
But the faster is the medication. That's why we go to medication first.
You got it, Lily.
Mind, it takes months before you start seeing any results.
I have patients that they saw results in a week.
Dr. Furlan, our time is giving us a red signal. You have so much of content in your bio that it is impossible for any host to conduct an interview and cover all the aspects of your studies, your experience, and what all you do, a great work for serving the humanity over here in Toronto and GTHA plus other countries as well. You're a consultant. At the same time, you teach at the University of Toronto. So that is also really, really great. So we salute you for all the work you do.
Thank you so
Keep
much.
it up. And would you like to give some final remarks, comments to our viewers?
Yeah, of course. And what I like to say is that chronic pain is a disease that affects a lot of people. It is an invisible disease, so a lot of doctors may have, not believed in you if you have chronic pain. They may have dismissed you and told you, oh, but you look normal, nothing is wrong with you. No, you have a real problem. It's real pain. And I like to leave a message of hope that they don't need to give up. If this treatment is not working, don't give up. Try something different. Be open-minded also to try some of the modalities that we talked here. Try a different exercise. If this exercise didn't work, try a different one, but don't give up. Mind-body therapies, explore. Try to find something that can help because there is hope there. For each kind of pain, the treatment is different. And try to find a doctor that understands pain and chronic pain, but don't lose your hope. Because I really see people that they come to our clinic and they say, I don't want to live anymore. It's really not worth living like this. So we have to restore their hope.
Thank you, Dr. Furlan, for coming to our show in person. It was an honor for us, both of us, Liliane and myself,
absolutely,
that you are with us. Because earlier, even we thought of interviewing via Skype also, but I said it would make a difference. I wrote to you. In person, it makes a great difference for the viewers and for everybody.
My pleasure.
And we assure you, they will again invite you in 2024, next year.
My pleasure.
Because we have got lots of contents remaining to ask, so many questions.
I'll be happy to come.
After this interview, lots of viewers will be also asking questions, and we'll be noting down those questions too for your next interview when you come back and answer them.
My pleasure.
So with that note, we will be signing out soon from our regular weekly show, Voice of Canada. Your host, Asphandiar Wadiwalla, and your female co-host is Liliane Bahloul.
Thank you so much.
And our wonderful guest speaker was Dr. Furlan.
Keep
up the good work. God bless you. God bless Canada. God save the King.